Welcome to this edition of Prostate Cancer Weekly, where our aim is to help men whose prostate cancer biopsy shows cancer make the right decision that will assure the highest possible quality of life and the best chance of long-term survival. I'm not a medical doctor, and I'm in no way offering you medical advice. You should consult your doctor before you make any final decision. Today, we're going to talk about how to maximize your doctor's visits and get the best information from your medical team. This is not just for your prostate cancer, but also for all medical appointments. Every time you visit the doctor, you need to take full advantage of the appointment. Most doctors are way too busy, and every minute with them is very valuable. As a matter of fact, statistics show that the typical appointment only lasts 18 minutes. So take advantage of every minute you get. Don't ramble. Don't talk about the weather. Be specific and have a plan. It's also a really good idea to bring a friend or a recorder to all appointments with your medical team. This is not to try and catch them doing something wrong, but to help you get all the information. It's great to have a reference later when you ask yourself, what did they say? Okay, let's get started. First, I would like to start out with a quote from a book I spoke about in our last video, The Empowered Patient by Elizabeth Cohen. When you visit your doctor, it says, ask lots of questions. If you don't understand something, ask for clarification. And if you still don't understand, ask again. The doctor or nurse might be visibly annoyed, but that shouldn't stop you. Remember, your health depends on your ability to comprehend what the doctor is telling you in the diagnosis and in the treatments. It's a good idea to do some planning for your upcoming appointment. Think about, what do you really want to get out of it? What specific test results or other information do you want to be sure to get? Don't forget to bring to your appointment a list of all the prescription medications, over-the-counter drugs, herbs, and supplements that you are currently taking. You know, I keep a master list on my computer, so all I have to do is go in, update any changes, update the date, print it out, and then when I walk in, I just hand it to them instead of having to write it all out, running the risk of forgetting something. It's also a good idea, if your medical history is somewhat complicated, to do the same thing. Start a journal or just a document that you can keep updated, so you can just print a copy before your appointment and hand it to the doctor or nurse. Again, it beats having to write it out each time, and it prevents you from forgetting to tell them something that could be extremely important. You could also do this for your symptoms. It is hard to remember that last week you had some sort of abnormal pain or some other minor event, chest pain, whatever, that might be important to your doctor, but you will most likely forget to mention if you don't write it down. How many times have you left a meeting or an appointment and said to yourself, I forgot to ask him about that? Well, don't forget to bring any recent test results from your other members of your medical team, like your oncologist. Even more importantly, if you have had a recent test and have not received the results, your doctor's office can get those results much faster and easier than you'll ever be able to. Tell them you've not received the results and ask for some help getting them. They don't really mind, and a call from a doctor's office gets a lot more attention than a call from you to another doctor's office or lab. And do not forget to ask for copies of all test results discussed at each appointment that you go to. Most importantly, bring a list of questions and prioritize them so you get answers to the most important questions on your mind. Be sure to highlight your top 3 concerns to make sure you cover those. And on my website, there is a page entitled Questions to Ask, which has a list of questions that specifically address some of the questions you might want to ask directly related to your prostate cancer. Before you walk out of your doctor's office for any kind of an appointment, you want to know at least 3 things. Your specific diagnosis, you want to write it down, you want to get the spelling correct so you can Google it later. Make sure you understand your treatment plan. If not, ask for clarification, or another way is just to repeat it back to make sure you got it right. What's next? Another appointment? How fast should you expect results? What signs should you look for that will let you know that you're responding to the treatment as planned? Also, it is a good idea to ask the best way to contact your doctor during normal office hours and after hours. Should you call or email or go through his nurse or the office staff? And who is the best point of contact if not the doctor directly? For more information about how to maximize your doctor's visits and get the best information from your medical team, I suggest you get a copy of Elizabeth Cohen's book, The Empowered Patient. It's available on Amazon or through my website under the Order Books page. Well, thanks for watching our show today. I hope that in some way we were able to help you in your journey to making the right treatment decision. If you liked our show, please visit our website at prostatecancerweekly.com. And don't forget to click on the subscribe button so that you will get an email each week with a link to our next show. Also, please feel free to forward this show to a friend. Post it on your Facebook page or even Twitter it. Thanks again, and see you next time.